Dr. Ashley Bourgeois completed her bachelor's degree at Iowa State University and graduated from the University of Missouri's College of Veterinary Medicine in 2010. She then completed a one-year rotating small animal internship at Purdue University. Upon finishing her internship, she accepted a residency position with the Animal Dermatology Clinic's Tustin location in 2011. She became a diplomat of the American College of Veterinary Dermatology in 2014. Dr. Bourgeois has been practicing in Portland, Oregon for the past 2 years and loves the adventure the Pacific Northwest offers. She has a strong interest in otology, allergies, and autoimmune skin diseases. In her leisure, Dr. Bourgeois enjoys outdoor activities, traveling, and watching sports with her husband, daughter, and energetic terrier. Well, welcome to the podcast, Dr. Ashley Bourgeois. How are you?
Good. How are you doing?
I'm fine. Thanks for being here. And it's a little bit late, so we're both on the same time. Usually, I'm talking to somebody who's hours and hours ahead of me. But you're in Oregon, I'm in Flagstaff, and we're it's both after dinner for us.
Yes. Yeah. Husband's on baby duty right now, so he's getting the little one to sleep. So.
Oh, well, thank him
it's good
for
them
me.
to step in once in a while.
Yeah. So, how did you decide that you wanted to become a veterinarian, and when did you decide?
Yeah, I was definitely one of those really young whippersnappers. I think I was in like fifth grade, and I just loved animals. And I'm sure we all start out that way, but I didn't really grow up with that many animals because my dad was in the Air Force. So we moved around quite a bit.
Yeah.
So, but every time I saw them, I just loved them. And I think there was a career fair when I was like in fifth grade where a vet came and spoke to us, and it just clicked, like I could actually make a career out of, handling animals. And I never really turned back after that.
Wow. You know what? I always wonder why it took me so long to figure out that I wanted to be a veterinarian. And it's because nobody came and talked to my fifth grade class.
Yeah, it totally was a game changer for me. So all those career fairs, people get asked to do, that was it for me.
And did you envision yourself all along as a small animal veterinarian?
That's interesting. So I always knew I would definitely do small animal. I thought when I went into vet school, my intention was to do small animal / equine. And then when I decided to specialize, that's kind of what I ended up in anyway.
You mean small animal only?
And I still do some horses.
Oh,
yeah.
you
But
do?
I knew, yeah, I do. So I still do some horses. I mean, 99% small animal, but getting to mix in that equine once in a while has been really fun for me.
Interesting. Okay, well, we'll get to that in a minute. But first I want to know, all right, so did you get into vet school on your first try?
Yes.
Congratulations.
Thank you.
And then what did you think when you started vet school?
It was intense, but I expected that. So the intensity of studying, all that kind of stuff didn't really surprise me too much. I think what was a very nice surprise was how fast your vet school class becomes your family. So that was the really cool aspect for me. I knew that I would obviously have really good friends, but to within a month or two just be so connected for those 4 years was pretty amazing.
Right. How many people were in your class?
I think they changed the class size a little bit, but we were around like 75, maybe.
Oh, wow. Okay. Yeah, that's pretty small.
Yeah, we were smaller. When I graduated, they ended up upping the class size, and now at least for a few years ago, it was around 110. So they definitely upped it a lot after I left.
Okay. Yeah, I think the smaller class sizes, it's easier for the whole class to be cohesive. I think I had like 90 in my class, and we all got along really great. But there were like little groups and little cliques, a little bit like high school.
That it can be a little bit, and even in that smaller class, we still had people we gravitated to. But I really did enjoy the size. I was really glad I was there before they increased the size so much, because I definitely knew everybody. We might not have been all best friends, but there definitely was that sense of community for sure.
Mm-hmm, mm-hmm. And did having those friends around you help you with the stress of all the academic rigors and?
Oh yeah, I mean, it's my lifeline. Just it's nice to know you're not alone. You're sitting there studying so long into the night, and to have those people that either you could study with, or if it was something where I really needed to study by myself, but we could, all be in the library together, just to know you weren't the only one going through it. And when I first started school, I was actually roommates in a house with somebody who was a year above me. So that was really helpful too, because she had just been through it the year before. And so could kind of relate to me, even though she wasn't directly going through it.
Mm-hmm. And what was your favorite part of being a veterinary student, or your favorite part of vet school, like a year or?
Yeah, the program I went to in Missouri was pretty awesome because we got 2 years of clinics. So our summers were really short our first couple of years, but we went into clinics by October of our third year. So I think third year was really cool because we went into clinics and we were all together. By fourth year, so many people are on free blocks, and it's still pretty exciting, but you're really looking forward to graduating.
That's true.
So third year was this really cool year where you're just getting into clinics, you're so excited, everybody's still there, and you still have a little over a year to go. So it was that sense of excitement, but yet you weren't trying to get out the door for graduation yet.
Right. I hadn't thought of that. I had talked to somebody else who's currently a student at Missouri, and he mentioned that 2 years of didactics and 2 years of clinics, which I was like, how could you cram all of the information into 2 years of lecture? But
our summers were only 6 weeks long. So they made up for it by shortening our summers. And then when we went back into our third year, we still had a block to go. So we didn't start until about fall of our third year to make up that time. But even though shortened summers probably seem, kind of like disappointing, to get that 2 years of clinical experience was totally worth it for me, because I'm definitely a hands-on person.
Right.
And we had a lot of flex time in our clinic years because we had the extra time where we could do more externships, or like for me, I did a lot of derm externships that were invaluable to me because we only had a part-time dermatologist at the school. So I really got to dive in and kind of create my own course that way.
Nice. Yeah, I remember fourth year clinical rotations, and what you mentioned is like a lot of your classmates, some of your favorite people, like they're off, they're away, you're on different rotations, you don't see each other anymore. And that was kind of hard. It was like, it was the beginning of the end, because you could feel that you were like losing the people that had meant so much to you for so long. And
definitely,
you could see the end coming. But to have that third year in the clinics with all of your classmates, that must have been amazing. And what kind of, so in fourth year rotations, you have quite a lot of responsibility for patients. Was it the same in third year, or was it a gradual transition of responsibilities from third to fourth year clinics?
No, it was the same. And that was the other kind of cool thing about it, was depending, because you signed up for different rotations. So, someone could enter their third year, and if the way that the rotations worked out, they were on equine first, you could be with someone who was already a fourth year towards the end, who that was just the time they took equine. And we had electives and stuff. So obviously you could take certain classes, where you really favored certain areas. But since we didn't track, we had to do all large, equine, small, path, clin path. So we had to rotate through all of it.
Wow.
So it was kind of cool though, because when you first started, even though it's scary to think you're in your third year, you're just getting thrown into it, a lot of times you were on with fourth year students. So you usually had someone that was showing you the ropes. So I really enjoyed it a lot.
Wow, interesting. Yeah, I wonder what an advantage that would be when you finally start practicing, because I felt it was a pretty rude awakening. Like 1 year of clinics wasn't really enough to prepare me for the real world.
Oh yeah, and I think you always feel that way to a sense, right? It just depends on when it happens. When I went into my internship, even though I had that extra clinical time, you still feel like you kind of get thrown into it at some point in your vet career. Probably more than once, you're going to feel like you just got thrown into it, because there's such a steep learning curve. There's always, you could not see a particular case the first 4 years you practice, and then all of a sudden you see something that you've never seen before. So it's always learning. There's always new drugs. You never start learning ever in this industry.
That's true. You're absolutely right. So we may as well just get used to that and try to enjoy the process and just trust our own self-efficacy.
Yeah. I mean, that's where getting comfortable with colleagues and not knowing it all, even, me being a specialist in dermatology, there's still tons of things that I ask my fellow colleagues about because cases don't respond the way you want them to. New medications come out that you're not used to. I have friends in other countries and they have certain drugs I don't have and vice versa. So it really just kind of depends based on what you're seeing and what you have available to you and what's coming out and what research has been done. So it's pretty cool.
So, well, tell me this, Dr. Bourgeois, like you say, you seem to feel very comfortable asking your colleagues, oh, I don't, what to do if this case isn't responding, blah, blah, blah. Do you feel more comfortable now that you've got all this experience under your belt versus when you first came out? Because I remember when I first came out, I didn't really want people to know that I didn't know what I was doing. And now that I have some years of experience, I'm like, yeah, I don't know what's going on. Can you help me?
I think so. I mean, I think when you start and you're, the young one, the young whippersnapper, and I was pretty young going through all my training. So even when I was going through my residency, there was a sense of sometimes clients would say, I mean, during my residency, I got asked, are you the doctor? How old are you? So I think there's a sense of maybe not feeling good enough or confident enough. But then as you practice, I think you do realize that you don't know it all, and that's okay. And even a way you approach it to clients, it doesn't have to be, well, I don't know, right? You can just say, well, it's really interesting. Like, this is a very interesting case. I would love to get some input from other colleagues. And you can twist it in a way that doesn't just make you look like a deer in the headlights and lack that confidence. So I do think it comes with experience, and you just start to realize we all have bad days. We all have good days. There's days I leave the clinic and I just feel like I rocked it. All my clients were happy. They're all doing really well. And then I can have an afternoon where I just feel like I've totally failed. None of them are doing well, or, every client seems frustrated or mad. So that doesn't make those days any easier, but because you get the experience of knowing that this career just ebbs and flows, I think you get more comfortable with not knowing everything or having bad days.
Yeah, I think that's that's really important for future veterinarians to keep in mind and to keep a perspective.
Oh, yeah.
Like, well, this day sucks, but then there's tomorrow and it might not.
I was just going to say, I think that the other thing to realize going into the field too, and I still struggle with this, is that it's okay for some days just to suck. Like, I'm a pretty positive person, but some days just are hard, and it's okay to say that day was really hard. So I think the other really cool thing in our industry is there's been a lot of outreach about wellness, how to handle the compassion fatigue, how to be okay reaching out to other people, because I do think there's a sense of pride too when you start and you think you should know everything and that everyone should be happy, where you feel like maybe you failed if you do have a hard day, or if you'll admit it's a hard day. But then some days and that's any career, just some days, no matter what you do, like, there's just going to be hard days, and you just have to say, I allow myself to have this day be hard, and then hopefully tomorrow won't be that way.
I like that. It's true. I mean, I've had hard days where I didn't even leave the house. Nothing went right.
Yeah. My gosh.
Crap. I don't know. My dinner failed. I couldn't do anything right.
Yes.
Yeah, absolutely. And I like that, what you said, just allow yourself to have a bad day. It's okay.
And I can say that, and I still, like, yesterday I had a really tough day, like, it doesn't mean that anyone's very magical and doesn't feel the pressures of those days just because they can accept that a day will be hard. You just do your best. That's all you can do.
Well said. So tell me about your internship. It was a small animal rotating internship. And I did not do an internship or a residency, but I've heard from people who have, and most of them say it's the best thing that they would never do again, or something to that effect.
Yeah, I think that's a fair statement. I always say an internship is meant to just be 1 year. Because by the year you are pretty fried, but in a really good way. So So I did my internship at Purdue, and I went into it with the intention knowing that I wanted to specialize in dermatology. So it was a pretty focused, goal for me. I know people who've gone and done internships who just want the experience. I found it extremely helpful. It was overwhelming. It was, a lot to handle because all of a sudden you're on overnights, sometimes by yourself, and you just finish school, and then all of a sudden you could have 4 or 5 cases lined up, and you don't have that, tenacity yet. Like, you're kind of sitting there trying to look everything up, or, you're trying to teach students because I did it at a university. But there's a super steep learning curve. So while I remember we had just opened the full-time emergency service, and it was 4th of July weekend, and I was the first one working.
Oh no, bad luck.
Yeah. Oh my gosh. And I want to be a dermatologist. I am, I actually didn't mind emergency medicine, but it wasn't my forte. I mean, I thought I was decent at it, but it's not my passion. So it was a lot, but I will tell you, within a month or two, it was amazing how going through that battle and going through the trenches, how much more confident I felt and how much I felt like I could handle. So I would say the first month or two is really difficult, but you kind of go on a speed course, and it depends on the internship, but you really kind of rocket ship up into learning because you are thrown into those situations. So I would definitely do it again. Even if I wasn't gonna specialize, because I did feel like I learned a lot, but every internship's different for everybody.
Right, right. And in terms of so veterinary interns don't get paid very much at all. I think, mid-20s, something like that.
Mm-hmm.
And, I've read some articles that talk about overall, it's a net loss. Unless you go on to specialize, and you make the higher salary as a veterinary specialist, if you don't do that, then you never make up what you lose during that year.
Yeah, I could definitely imagine that being true. And I think it really depends on what you want to get out of it. And it depends on the program. If you find amazing mentorship, the right out of vet school, at a practice you want to be at, I personally don't think everyone has to do an internship. For me, it was worth it. Not only because I specialized, but because I didn't necessarily have a place I was going back home to, a clinic I knew that was going to be great mentorship. Mm. And I just really thrived in having that time where I was just inserted into everything, because I am a very hands-on learner. Mm-hmm. So even, if I couldn't make up that year, financially, in the long run, it was worth it to me. But I really think everyone has to make that personal decision, because you don't make much, you work long hours. I wasn't married, I didn't have children when I went through it. So there's a lot of factors that go into it. Internship is not cookie cutter at all. I had friends who, had children during their residency, and that was really difficult for them. They did it. They pushed through, and they're super tough women, but I didn't have those factors when I went through. So you really have to put all of that into perspective when you're making that decision.
Right. And during your internship, even when you were on your overnights on emergency, you had somebody to call if you had to, right?
Yes. So the way that ours was set is that we had somebody that actually, not a boarded criticalist, but a local DVM who did emergencies. Oh. They would actually stay with us until they had standard hours they would work in the clinic, usually till 1 or 2, most times. Sometimes they weren't there. And then we always had a criticalist on call that we could at least call and run cases by them, like lab work, or send them pictures. And then we always had a resident within each specialty on call. So we did have that support system, okay, which was great. So you kind of had that in between. They're not right there to see the case with you, but you definitely felt like you had somebody that could help consult with you.
Right. It wasn't just you and the internet.
Yeah. Sometimes they come in and you don't really have the time just to call somebody, but for the most part, you could feel like you had somebody to run things by, for sure.
Mm-hmm. And then, so transitioning from clinical rotations, I remember, is nothing at all actually being, primarily responsible for patients. And so, as the intern, you had, for the first time, primary responsibility for patients. Plus, yes, you had to teach fourth year students, right? So, and did you feel like you had to put on a front, like, oh, I'm the intern and I'm supposed to know what I'm doing, because I'm teaching these fourth year students, but like, 3 weeks ago I was you.
Right.
Yeah.
No, it's completely true. We never had to specifically really run rounds by ourselves for the students, at least in my internship, but we did have cases where we were primary care and there'd be a student assigned. There were definitely times that I kind of, had to throw my hands up and say, I have no idea. And it really depended on where you were interested too. When any ear infection or skin case came through emergency, everyone was asking me because that's what I wanted to do. That's what I felt comfortable with. But like for me, I did not like cardio or really, a few specialties I just really didn't like. And so if they would ask me anything about that, I would have minimal knowledge. And I had no problem saying that. So that was kind of the nice thing too, is in my intern class, we were all really close and we all had fairly spread out interests. So we kind of had each other's support for those cases. Even, if we couldn't get a hold of a resident, we had the faculty members and then our own intern mates that could help us. But yeah, you definitely feel kind of, I was just due last year. I was just due like 3 months ago finishing this. There is definitely that fear when you start, for sure.
And did you feel like you had to put on an act? Or did you just tell the fourth year student, well, I don't really know what's going on?
I would say half and half. I wouldn't be afraid to say sometimes the good thing about sometimes being in charge is you could say, you should go look that up. And sometimes that would be cover for, I have no clue. Right? That's what you could do. It's better for them to learn and then they come back and tell you the answers. So there was definitely times I felt like, they would say things and I would say, yeah, that sounds really good. But there were times that I had no problem. The cool thing about going through an internship too is I had really great students. The fourth year students were really wonderful and I got along with them well. So you develop a kindred friendship with them pretty quickly too. Mm-hmm. So, within a few months, I knew a lot of them so well. I had no shame in saying, I don't know, that's a really good question. Maybe we should figure it out. But the first couple of months when you're really discovering yourself as a doctor, you're in a new hospital, you don't know how the computer systems work, you're overwhelmed. There was definitely probably some fronts put on.
Mm-hmm, mm-hmm. But that's nice. I like that you point that out. Like once you get to know people, like it's such a load off your chest to just be able to be authentic.
Oh yeah. And I couldn't live not that way. I'm not a person that's really good of faking anything or fronting. I'm usually a pretty genuine person. So once you get comfortable and realize we're all just in this boat trying to educate and get through it, it wasn't a big deal for me to admit I didn't know something.
All right. Well, what about your residency? And you got to do exactly what you wanted to do all the time. And let me just tell you, okay, I just want to know, are dermatologists like the happiest people on earth? Because if you like dermatology.
Yeah.
Because the human dermatologists that I've met, oh my gosh, they're so happy.
We're a pretty joyful bunch. I just got back from our annual conference last week. And the really cool thing about our college is we are, well, I guess now we're kind of considered medium sized. But when I first started going to the meetings, we're a fairly small college, especially if you compare it to like emergency and surgery and medicine. They're much larger than we are. Now we're starting to gain some traction where we're bigger than some of the other specialties, but you still see a lot of people, there's a lot of camaraderie in our college. So yeah, we have a really good time at our meetings. Obviously compared to a lot of specialties, our hours are pretty controlled, which is nice, but we do deal with some chronic, frustrating cases because for the most part, 90% of my patients don't ever get to be done with me unless they choose to be.
Exactly.
Unless I get that rare scabies case, like they're seeing me forever. We're always managing. So we do deal with our own set of, frustrations, difficult clients, difficult patients, but there's definitely some perks to, loving loving the field of dermatology.
Mm-hmm. And so the residency was 3 years.
Yes.
And I have no idea, what do you do like in a
Yeah.
dermatology residency?
Lots of skin. So essentially what we would do, and so I did my residency at a private practice in Southern California. So is very heavy case based, which I really loved. And it worked out extremely well for me to end up in that residency. So it's a lot of primary case. I mean, pretty much within a couple months, you are very much the primary doctor on the case. We would spend the first month or two shadowing a lot of the dermatologists just to get used to it, because all of a sudden it's even almost more pressure because in an internship, you're, at least for me, I was in a university, I was in a teaching establishment. I wasn't the specialist necessarily in that field. But when you're a residency, all of a sudden you're being seen, at least for me, when I wasn't having that intern title, I mean, I was considered the specialist, even if I had just been in my residency a couple months. Luckily, I had always been interested in dermatology, so I had a pretty good knowledge, probably, beyond what most people would have out of vet school, just because it's what I was passionate about. But it was pretty intimidating to all of a sudden have to do your own allergy spiel or know when to biopsy, things like that. So we would see a lot of cases, and then we do a lot of basic sciences, journal clubs, literature searches. So we had journal clubs twice a month where we actually had to review 4 to 5 journal articles and discuss them. So we knew the new science coming out. And then we actually had to present monthly at what we called resident training days. And that was essentially making hour-long PowerPoint presentations about very specific scientific topics like cornification, keratinization, things that people probably wouldn't want to know if they didn't love dermatology so much. So those were kind of the main things. And then we would help, do consults on horses. We went to the zoo a couple times. So we got to do some pretty cool things.
Right. And I recently, so you and I connected via Instagram, I think, and
Yes.
I saw your post that this was pretty recently, you got to do a lecture at the Oregon Zoo.
Yeah, so that was actually, it was just about, well, I shouldn't say just because it's most of what I do, but it was mostly about pyoderma, so bacterial skin infections. But the local Portland Veterinary Medical Association often holds their meetings at the Oregon Zoo. So it was just doing it within their facility, but I've lectured there a couple of times, and it's always a surreal thing for me because I love public speaking. I really am trying to make that a really big part of my career. Is I love derm so much, and I just want to be able to help other veterinarians know the advanced cases and what we do and the new medications coming out. So it was pretty cool to get to speak there again recently. I've done some work at the zoo with the zoo veterinarians to skin test some animals there, so that's been pretty cool. But that particular lecture was more just for the Portland VMA.
Okay, so it was like a continuing education for them.
Yep.
Okay.
Yes,
And do you get paid for that?
I do. So, well, it depends. Most of the time I do. The veterinary medical associations, a lot of times those, because it would be really difficult for them to support a speaking fee compared to like a particular company sponsoring you.
Right.
So sometimes, payments can be cash. Sometimes they're a $50 gift card. Sometimes it's more just to do your due diligence. So we often do get paid. A lot of times the big conferences in the actual like veterinary medical associations won't be very much. Or I've done them for free just to help.
Right, right. And to get your name out there and
Absolutely. Yeah, it's good marketing for me. I get to meet the local vets, which I love because it's always nice to meet them in person rather than just over the phone for cases. So there's tons of benefits to it. But you have to love public speaking. I mean, I have plenty of friends in my field who would never want to get immersed into it like I have been.
Mm-hmm. But when you say you'd like to make it a bigger part of your career, but sometimes like the veterinary medical associations or even the big conferences don't pay that well. I mean, is there a way to make a reasonable career out of it that would be commensurate with what you make as a veterinary dermatologist?
It would definitely be supplemental for me. I mean, I'd have to do a ton of speaking in order to make up my salary. But you can sometimes, if you get certain events that you are sponsored by particular companies, then those ones will have usually better payment.
Mhm.
But yeah, a lot of times if you see speakers at conferences that they're at the conference, they're doing like 4 to 5 hours, but it doesn't say like sponsored by a particular drug company. Usually we're still getting paid, but usually considering sometimes I've spoken for 5 or 8 hours and had to prepare all those lectures ahead of time, it's usually not very much in the grand scheme of things. But the ones that are sponsored by particular drug companies, they can pay a little bit better.
Mm-mm. But I mean, it sounds like it's something that it's not really about the money. You just love the camaraderie and the meeting people and the helping, GP vets.
That's right.
Feel
Like
more comfortable.
for me, it's really about, I love connecting with people. I mean, that's what just like this, like us being able to have this podcast. I mean, I just really love not being stagnant. I love connecting with people. I love seeing what other people are doing in the industry, even if it's not just dermatology. The health and wellness part of veterinary medicine that's really starting to make a splash. I'm really passionate about that.
Mm-hmm.
So it really does bring me joy, regardless of, having to work a lot in the clinic and then come home sometimes and work on lectures. For me, it's finding a balance because I do have a family and I still like to give them my attention too. But my family also knows that I love being able to do it. I love traveling to these conferences, meeting veterinarians. I love when I can give them a little nugget that they really can take home and practice better medicine with. So it really, truly is about the connections and just feeling like I'm bettering the community that I love.
Uh-huh. And so your husband what does he do, if you don't mind my asking?
No, it's okay. He's a civil engineer.
Okay. So
Yep.
he's
We're very different. I mean, we're very similar, but our fields, we don't really have too much. He tries to talk about angles and bridges, and I don't know. I have no idea what he's talking about. But if I come home, I showed him my really cool cat case today, and because I'm derm, at least I have cool pictures. But I showed him, he's like, "Oh." So there's some talking about our careers, but for the most part, we're not very relatable.
about your two smart people. But it sounds like
I
he's
like to think so.
supportive of you. And so you can, I mean, even though you've got a young child, you still get to
Yeah.
travel, go to these conferences, and your husband picks up the slack while you're gone.
Yeah, it's a balance because we both I wouldn't say we heavily travel with our careers. For me in speaking, it's feast or famine. It really fluctuates. I mean, I choose to do lectures. I don't have to say yes to all of them. So I can have a really busy time, like November, December. I actually had a lot of conferences and lectures, but then I kind of had a lull for a couple of months, and then I spoke again in March. So I kind of pick and choose, and then he occasionally travels for his work too. So it really is about balancing it. We do have a 1-year-old daughter, so that's definitely thrown a different twist to it. But I was never meant to just, not progress. I mean, I wouldn't be happy, and it just makes me appreciate my family time more because I strive to find that balance rather than giving things up.
It's so true. It's so true. I mean, if you had all day, every day for months and months to spend, with your husband and your daughter, as wonderful as they are, I mean, it would not be satisfying over a long period of time. I think we all need that variety and diversity and growth and challenge in our lives, even though I think sometimes we think we crave, like, I just want to stay home and sit on the couch for a while, but I don't think
Well, and sometimes that's true. Like there are definitely some days I could probably sit all day on the couch and I would be fine. And there's days where I leave for work and it is extremely hard because my daughter's in a great mood and she's so happy, and that does make it difficult. But yeah, I mean, the flip side of that is sometimes if I have to take time off, like there's certain holidays that her daycare is not open, and if I have to take extended time off, if we're traveling and doing things as a family, I'm totally fine. But if it's just like me having to be at the house and get stuff done after a few days, I'm kind of like stir crazy. So
yeah.
it just depends on your personality. I mean, I know moms who stay at home and they absolutely adore that and love it. I am meant to be somewhere in the middle. I mean, I'm meant to kind of have a lot of things in the air, even though sometimes it can be overwhelming. If I get the flip side of that and I'm underwhelmed or still, that's almost more detrimental to me.
It's what do they call it? Eustress versus
Yes.
just like we need some stress in our lives in order to grow and be happy for some reason, but it's you.
Well, and if you're going to go to vet school, I feel like most of us are probably like that, right? Because if you're known to be a person who's not willing to like kind of step up and do things, like you're probably not going to put yourself through that process.
Right. Good point. Good point. Now, do you own your own practice or are you an associate veterinarian?
Yeah. So I am an owner within several practices. So our particular company owns several dermatology clinics throughout the country and actually a couple in other countries. And
Wow.
so I, about, I guess, a year and a half ago, actually bought in as an owner. So I am a shareholder within our entire company.
Nice.
Yeah. And
Nice.
I've really loved it. It's given me that balance because I also love like the business side of or veterinary medicine. I find it really fascinating to think. That doesn't mean I'm terrible with like accounting numbers and stuff, but like the philosophy of how to make the clients happy, how to be efficient, how to be proficient with your staff. I mean, those kind of things I find really interesting, what makes a clinic successful versus not successful. So it's been a really good intermediate for me to be an owner within a business, but we still have a management company that does the nitty-gritty stuff that I don't necessarily want to do.
Okay.
So I feel like I get to be involved in the business aspect without feeling like I'm coming home and doing the books. So it's been a really good situation for me.
Interesting. And these clinics, are they like purely dermatology or?
Mhm.
Wow.
Yeah, they are. Most of them are standalone. We do have some that are within specialty clinics. Like, they'll have several kind of independent specialties within one building. So it's a kind of a mix, but we're strictly dermatology.
Interesting. I didn't even know this existed.
Yeah, there's a few. I mean, like Eye Care for Animals does ophthalmology kind of very similarly.
Right.
And then we have dermatology. There's another very successful company that's another dermatology service. So yeah, you can kind of find mixes and matches of everything.
Now, is dermatology, I mean, does it pay well compared to, for instance, a veterinary surgeon or internal medicine specialist?
Yeah, it really depends, I think, on what company you're with. I know some of the bigger in names that kind of have multiple specialties within their hospitals. I think they'll kind of pay a base salary that's very similar. The production could be different. Since I'm only in dermatology, I don't know specific numbers that they do, but I think that might be where it's differs. Dermatology compared to, like a surgery, we don't have as high of cost, but then we also don't upkeep as much expensive equipment
Right.
as surgeons do.
Right.
So, I mean, we have our videotoscopy unit, and that's probably our biggest piece of equipment to keep up with. I mean, some of us have laser to laser certain masses off of the skin, but compared to what surgeons have, and even medicine specialists with all their scopes, we don't have as much upkeep. So it would probably just depend on how successful you are with either. I know internists that probably do much better than I do, and I know some who don't, just depending on how busy they are, the market that they're in, what type of equipment they have.
Hmm. Okay. Well, I mean, do you mind if I ask you how much debt you graduated vet school with?
No, I was somewhere in the mid 90s, 90,000. And then I deferred during my internship. And then I'm trying to remember, I might have deferred through part of my residency. I know I didn't do all of it, maybe like the first few months. So my interest ended up getting to probably around 110.
Yeah.
That was probably around my highest.
Yeah. Yeah. And I mean, as a dermatologist married to a civil engineer, did you say?
Yes.
Civil engineer. I mean, how are you getting by? Do you guys struggle financially, or do you feel pretty comfortable being able to pay? Because he's probably got student loan debt too.
Well, he actually didn't have much student loan debt, so that's where we lucked out. He went to an in-state school, did well with scholarships, and where I was very fortunate. So we're comfortable. We're being pretty aggressive with my student loans right now because we just hate that. I mean, who doesn't? But like,
Right.
we are willing to kind of sacrifice to help get rid of that. So I would say we're comfortable. He had was a big saver, so we're both pretty big savers. But then I did a residency, so I wasn't saving very much. but he was saving pretty aggressively before we got married. So we bought a house last year, and then we're still being fairly aggressive with my student loans as
Well,
well.
congratulations on your new house.
Thank you. Yeah, it was really exciting. It just really, last year was a huge year for us. We had the baby. We bought into the business. So there was a lot going on.
Wow, wow. And so let's talk about your other love, the fitness and the
Yes.
pushing for taking care of yourself, and
Yes.
you do coaching, right? Like fitness coaching.
Yeah, so I'm a Beachbody coach, which is basically like online coaching. And where that fit really well in for me is I've always actually loved fitness. I've always been an athletic person. It was never something I thought like I'm going to make a career out of it, but I was always just loved it. I loved exercising. I loved being into sports. I'm a sports girl. So it kind of fell into my lap actually through one of my vet school classmates. I was already into fitness and really enjoyed it, but I was looking for something a little different. I was looking for something I wasn't a big yoga person, but I knew it was important. So there was a particular program they had that was a hybrid of Pilates and yoga that she talked to me about that I found really interesting. And so I ended up kind of inadvertently signing up just for that program, and it came with some health supplements. And I ended up falling in love with it. And I was a former gym rat, never thought I would not go to the gym, but I ended up falling in love with it. And now I just completely work out from home and really try to help other people in our industry find that time. And it really has ended up being a lifesaver, especially now that we've moved. We have a little spot in our garage that we kind of have as our gym, and we've saved a lot of money not having that monthly membership for both of us to go. And now we would have had to pay for someone to watch the baby while we were there too. So now that we have my daughter, it's been a lifesaver because we just get up early together every morning before work, and it's our kind of carved out time. So It wasn't something I necessarily thought would happen. It just was natural. I just loved it. It's kind of that helping people aspect again, especially now that I am a mom and trying to balance, the mom time and then the self time and then the business time and then the vet time.
I can't even imagine.
But it's honestly, it just has been amazing to reach out and reconnect with old classmates that now we're on this journey together. So it's really I found a very freeing place with it, reaching out to other veterinarians, because it's helped so many of them be able to carve out, even if it's just 30 minutes, just something for themselves. Like it just reminds them that really is important, not only for our family, but also for our careers. Like you can't run on empty all the time. I mean, I ran on empty sometimes on overnight shifts when I got to, my 10th night in a row, and you're not confident in your medical decisions. You're not happy at work. You're more aggravated to your, staff. So it really is kind of a health well-roundedness that I look at is we don't expect any of us to, be on the next Sports Illustrated cover, but like, we just want to be happy and fulfilled. And so it's been a pretty cool progression the last couple of years to be involved in that.
Right. And I've seen some of the pictures you were posting, like before and after pictures. So, I mean, as a busy veterinarian, a mother, a wife, like, can you tell me about some of the struggles that you had with balancing your health? Because you were much heavier before. And like, what was it? Because I went through the same thing, like just working all the time and not taking care of myself. And you just get in this vicious cycle. And then one day you wake up and you look in the mirror, you're like,
what happened?
Heck are you?
Yeah. Yeah. And it was especially so when I got involved in it, like I said, I'd already kind of something had switched for me. For me, honestly, it was a lot of nutrition. Like I loved working out, but like I love food. Like I love food. And now I live in Portland, and it's like tons of foodies. So that was my struggle, was the nutrition aspect of it. But and that's why getting involved in that community where they had really good, wholesome products and things that were quick and easy, but healthy. Because I definitely was a easy to grab type person, bag of chips here, they order pizza in the lounge. And so that was the part that I really struggled with. Even though I always loved working out, like I didn't eat very well.
Mm-hmm.
And that was especially hard for me even last year when I had my daughter, because even though I worked out a lot during my pregnancy, so easy just to reach for whatever, because you kind of feel like, well, I'm pregnant and I was pregnant over the holidays and everyone says, oh, you should just, you're pregnant, you can eat whatever you want. And then I actually ended up having my little girl was over 10 pounds when she was born. So I had a lot of baby. And so a lot of support I was giving her when I was pregnant. So when I got cleared to kind of get back into things, it was hard for me to kind of snap that portion of my mind to getting back to truly eating healthy and, finding that time in a different season of my life where all of a sudden I couldn't just go to the gym for 2 hours. Like I had to find the balance of being okay with that this season of my life, healthy looks much different than say, before vet school when I had a lot more time.
Interesting.
So yeah, it's kind of realizing that, if I have another child, I'm going to probably go through something similar again. So I think realizing that I'm a habitual person, but you have to be willing to change. You have to be willing to say, you know what, like if I get 30 to 40 minutes done in my garage, that's a good day, versus like I'm training for a fitness competition, so I'm going to spend 3 hours at the gym. Like you shouldn't feel like a failure just because it's different, because you're in a different part of your life.
Absolutely.
Maybe when my, kids are older and I have more time, maybe I'll want to do something crazy and cool like that again. But that's not going to happen right now.
Yeah. That's invaluable information, because I think so many times we think if I want to change, I want to lose weight, I want to get fit, I want to be healthy, but if I can't do it 100%, then why bother, when it's really just incremental, tiny things, if it's only 10 minutes a day, and that's something that I'd like future veterinary students to keep in mind, because when you get into vet school, holy cow, if you thought you were busy studying for your organic chemistry finals, just wait. But it's still...
And it can change where you are too. Like even in vet school, there would be semesters that weren't as bad, or there would be a clinical rotation that wasn't as bad. And then all of a sudden you'd end up on your overnight rotation and it would be a disaster. Like you couldn't do anything for like 2 or 3 or whatever amount of weeks. So yeah, it's a hard lesson to learn, and I still have to be okay with it.
Mm-hmm.
I'm still learning. No one's perfect. But it is something that switches in your mind that I call them small failures. Like you can't just go off the wagon because, we were in Hawaii last week for my conference and I had some Mai Tais and I had, a lot of carbs. And that doesn't mean like I just go off the wagon. Like I came back and I was like, that was a really fun week.
Right.
Now we're back in real life. And so it's a confidence thing I think you get, as you get further into life and go through all these things. But that's what I'm trying to teach other people too. Is just whatever healthy looks like to you is what you have to be striving for right now. And that's the same for everybody.
Whatever you can do today. And if it's nothing, then tomorrow. But don't like throw it all out the window because you're on, 10 overnights in a row.
Yep, that's exactly right. And we were actually doing like 14 nights in a row, which they changed after we left. By the 10th night, that was like when I hit the wall. Then you had to push through like 3 or 4 more nights. Luckily, they changed that because it was brutal. Yeah,
because what were they? They were supposed to be like a 12-hour shift.
If we were lucky.
If you were lucky, exactly. It was probably more like 14, 15.
Yeah, 14, 15. Yeah, it was pretty brutal. But luckily, they changed it after we left to make it not so many nights in a row.
Mm-hmm. So, do you have any specific advice for future veterinarians in terms of getting through vet school, or what if they want to follow in your footsteps? Is there anything that, like lessons that you've learned along the way that you think would make their path a little bit easier?
That's a really great question. I think for me, one would be have an open mind. I did not go into vet school thinking I wanted to specialize in dermatology. I pretty quickly fell in love with it. Like in my first year, I knew that's what I wanted to do, but it's not what I entered in necessarily looking for. So the cool thing about vet school is you do get immersed into so many different subjects, so many different, I mean, I have friends who went to do small animal and they ended up falling in love with equine during vet school. So I think having that open mind and not being so short-sighted, because at my school, because we didn't track, a lot of times when people had to be on large animal, they would complain because they only want to do small animals. So why care? And they wouldn't make that experience valuable. And even though I knew I was probably never truly going to work on that many, cows, like going into it with a really good attitude and just being open-minded, because maybe you can relate to someone else that has a farm dog, but they're a cattle farmer in the future. I mean, just realizing that experience is the one time that you're going to have that immersion into so many different aspects of our veterinary field. So keep an open mind, because you might really be surprised what you fall in love with. And then I guess the other thing for me is truly realizing that it is a season of your life. It is 4 years, and it seems like a lot and it seems overwhelming, but they truly do fly by fast. And I think a lot of us, sometimes I almost wish I could go through some of those classes, because I'd probably appreciate them more now.
Right.
So even when it's hard and frustrating and you're sitting there at 2 a.m, very upset that you're still studying anesthesia, like that's the only time in your life that is your job, is to truly just learn without having to worry about, the stress of primary case responsibility or angry clients. So just breathe it in and take it for what it's worth, because 10 years down the road, you'll probably wish you had that time back.
I do feel a little nostalgic for those days.
Yeah, where you could just go back and learn. And especially when you see those cases in real life, to even go back to how the kidney works, and, it just, that kind of stuff is invaluable to learn.
Right. And you know what? The interesting thing about medicine is large animal rotations. Not my favorite either, but medicine often overlaps, even if they're different species. Like you'll learn about, well, this antibiotic works best for skin, or this one's better for bone or respiratory, and you'd be surprised what you could learn, while learning about practicing medicine on a species you never intend to practice on, that may actually come back and help you later.
Oh, it's so true. I mean, there's a lot of crossover, and that's true even into humans. I mean, there's a
For
lot
sure.
of crossover that we have to learn about for antibiotics. I mean, a lot of the medications if we write prescriptions for, I mean, they're human medications. So it's super true. There's a lot of crossover, and there's a lot of appreciation, even if you're not going to become a certain type of veterinarian, just knowing what that normal day looks like for them, so that you kind of have an idea how different it is to be, say, a cattle farmer versus going to a small animal clinic every day. You just have an appreciation that that's a different life. And so then at least you relate to them versus having zero clue what that world looks like.
Exactly, which is one of the reasons I'm doing this podcast.
No, I think great.
Yeah, so I mean, people can see not just what they do, but what are their lives like.
Yeah.
Yeah.
No, it's different. I mean, in my large animal rotations, I remember getting up super early and going to work, the state fair, and check the sheep there. And we would get up really early to go help do, tons of vaccinations on a bunch of cattle, or help castrate them. And did I ever think that is what I was going to end up doing? No, I was pretty confident I was not going to be doing that. But I appreciate it for what it is. I at least kind of understand the process of, those farms, or kind of what they go through, even if I don't know the specific diseases anymore or medications they use.
Yeah, it's like I don't know, it's a world that you got to peek into and live in for a short time, and now you know kind of what it's like.
Yeah, definitely.
Something I am curious about, I mean, as a specialist, and I wonder this about a lot of different specialists. So dermatologists, I know surgeons do this, cardiologists do it. I don't know about internal medicine, but you could be you could travel to different clinics as a private, a company of one.
Yeah,
And
you definitely could do that. I definitely know some people who do that, and we're probably one of the specialties that it would be easier in because we don't have a ton. I mean, I can do 90% of my cases with slides and I guess a microscope, but most clinics would have that for you to use. And, a scalpel blade. Like, sure, I love doing a videotoscopy, so those cases pop up, and that obviously requires different equipment. But the day-to-day stuff we need as far as an overhead of supplies is pretty small.
yeah.
So there are people that do that. We run satellites sometimes out of our bigger clinics. So if there's a certain area where we don't necessarily have the support or enough people to maybe have a full-time dermatologist there, we will have satellites where we will go and see cases, once a month or depending on the need, once every other week, just to provide that care to a different area. So there's definitely that aspect in our part of the field.
Interesting. So like telemedicine.
Yeah, I guess in a way, except for you're there, you're like going
Oh,
to those.
okay.
Yeah,
Oh, okay.
yeah. I wouldn't feel it's hard because even though taking in cytology, taking a glass impression smear, or checking the ears seems like it should be pretty standard. Like people collect them in much different ways, so it would be something that I would probably want to do. I mean, personally, I don't have my technicians or staff read my slides for me. I do all of them because I mean, I kind of figure if people are coming to the specialist, that's what they're
Absolutely.
for.
Right.
So I read all of them and collect most of them. I mean, if I see something cool, obviously my staff can always come see it, but I don't have them just tell me the results. I always look at it myself. So at this point anyway, I would still be the one going out there and actually doing the consults.
What about telemedicine as a consultant to like general practitioners?
I definitely do phone consults all the time. And even, is that what you're talking about? Is like telephone consults?
Yeah, I guess so. Or even, like this, what we're doing right here,
Yeah,
as
I haven't done anything like this. I definitely get pictures sent to me. I get phone calls to my clinic of either a veterinarian needing help with a case, or they do live in an area that doesn't necessarily have a dermatologist nearby, or the owner can't afford it or doesn't want to. I haven't done video or kind of like how they're starting to do in human medicine, kind of like showing, bringing the camera up close. But we definitely do a lot of consults with the veterinarian themselves.
I just see dermatology as one of those things that might lend itself well to some of these newer technologies that are being.
Oh yeah, I could definitely see that. The hard thing is, and I'm sure that this is true in human medicine too, even be able to see like a picture or take a video and get really close, like sometimes it can really matter still on technique, of collecting things, of feeling it, of palpating it. I mean, a cat I biopsied today had nodules on the back that if you just took a picture, you would never see them.
Huh.
But if you actually feel and palpate and manipulate things, then there was a bunch of nodules. So I think that would be true to a point, and it would probably be, seem like for sure we would be one as a visual specialty that would work with. But I would have a few reservations about some of that stuff because we really are our organs right there. Like we're all over the animals when we examine them, like looking at the toes and really separating the fur. So it would have to be a really good person on the other side that I trusted.
Interesting. Well, it'll be fascinating to watch how it evolves over time.
Oh yeah.
I know the
Yeah. And that could be
AVMA.
helpful in places where they don't necessarily have specialists nearby. That's where I could see it being
Yes.
really helpful. Yeah.
Yes. Oh my gosh. I mean, I can't imagine the number of general practitioners who would just love to be able to like dial in and talk to a board certified dermatologist face to face, even if you can't be there and touch the animal yourself. The general
Yeah.
practitioner would get so much comfort out of it.
Yeah, yeah. I mean, it'll be pretty interesting to see how things evolve, even, with technology the way it's been, us getting much more either emails or, we have a whole community where we kind of, even to each other send really interesting cases too. It's amazing how much better it's gotten with the way that cameras take amazing pictures and hopefully some middle ground somewhere. I don't want to be replaced by a video camera quite yet.
Oh, no, no. You'll never be
I'm just
replaced by a video camera. Well, I won't say never, but I don't think in our
right.
lifetimes.
Yes, hopefully not in our
We have
lifetime.
quite a long way to go. But, look at like radiology, for instance. A lot of
Yeah.
clinics now. I remember when I first practiced, like I was straight out of school and I was doing overnight ERs by myself and I had to read my own radiographs. It was
Yeah.
crazy. Okay, let me
Mhm.
look at it and see what I think. But a lot of clinics now are having like every single radiograph is read by a board certified radiologist. And it's just sent over the internet. And,
Yep.
in a few hours you get the opinion of a specialist. I mean, I don't
Yeah, it's pretty amazing.
It is. It is. I just imagine that could be something. I don't know.
Yeah.
Sounds like something that could be really neat for, like you said, people who specialize in actually like visual pictures and
Yeah.
yeah.
Yeah. Or at least even if it's not like, here's exactly what it is, I would definitely feel comfortable saying, I'm suspicious of this. Here's what your next step should be. So that's
Exactly.
usually what it ends up being, because it is really difficult sometimes to just, I get it all the time. I get it all the time from even my family members where they take a picture and they're like, what is this? I'm
And it's a
like, well,
crappy picture.
it's a little more complicated than that, but I at least know you should go get it biopsied, or you should do a cytology, or you should definitely do a skin scrape because that looks like mites. So I could definitely see that aspect of guiding vets
Hmm. Yeah. Yeah. Well, I would certainly like that kind of assistant because
through it.
dermatology is not my thing. So, is there anything that you would have wanted to talk about that I have yet to ask you?
I guess for me, just like I said, keeping an open mind is so key, because I cannot tell you, and this is probably the specialist portion of me coming out, how many of my classmates hated derm, like hated it. I know you probably do. I know if you're not a dermatologist, most do, but I get called all the time about things that are pretty straightforward and simple because they just glassed over in school because they hated it. But the
Right.
reality, you're going to go into most general practice situations, it is going to be a huge chunk of what you do.
Yes.
So from the dermatologist to me,
Yes.
if you hate it, if you're going to go into general practice, like you better have at least some appreciation for it and not just fall asleep during school in those classes, because it is, every study that comes out, either ear disease or skin disease, is always in the top 3. So just remember that. And that's the dermatologist portion of me, not the, I guess the vet school advice necessarily, and always be willing to learn. Like even when you're done with school, and I know we already touched on this, you cannot, there's a reason that all the states require continuing education credits. Like things change. In the time that I've been involved, even just in the dermatology field, the last almost 7 years, like we've gotten 2 or 3 like monumentally life-changing drugs. So you have to be willing to evolve with the industry. You have to,
It's
because
so true.
you don't want to end up being the vet that, we all can picture the stereotypical vet who's older and just, kind of just wants to keep doing things the same way. Like take advantage of always learning, because if you're in this field, you should be fascinated by it and you should really want to learn. One of my favorite things to do is go sit through lectures and conferences, because I get to see how other people are doing things. And I don't think I'll ever lose that passion. Like even if they're using the same drugs as me, there's different techniques, there's different combinations or different ways to do things.
Right.
So don't let vet school be the end of your learning. Like you should always, always, always want to be educated.
Yeah.
And that's why I think most of us would love to go back to school, because we'd appreciate it more.
Absolutely. Absolutely. Well, I mean, quite frankly, I thought that when I graduated vet school, I would know everything. I don't know why I was so dumb.
It hits you pretty fast that you do not know everything.
Holy cannoli. Yeah.
Yeah.
Well, here's, what you were talking about earlier about from a dermatologist perspective, telling, if you're going to work in GP, even if you don't like it, so you really need to know some things. Oh, like, what are the things that you see as a dermatologist that get sent to you that you think, oh, you should not, like, you should not have had to send this to me? What are some
Well,
things that you want general practice future veterinary general practitioners to know or do before they send a derm case to you, the specialist?
Yeah, I don't know if there's necessarily a case like a disease process I would say that with, because I'm pretty much willing to see anything. And allergies are so prevalent, and that's the majority of what we do. But what I would say, my two things that are their diagnostic tests: do cytologies. Like, just do them. Like, every time I lecture to vets, it's like on half of what I talk about, whether I'm talking about skin infections or allergies or ear disease. I'm like, do your cytologies, do them, do your impression smears, just do them. Even if you don't feel confident, one, you can get better at them if you don't do them more.
True.
And what I was just giving a lecture yesterday over lunch, and the thing I told them was, even if you don't feel confident, like maybe you don't feel great that you could pick up acantholytic cells for a pemphigus case on cytology, but you can probably at least look at that case under the slide and say, I don't see bacteria, I don't see yeast, that's something weird, we should biopsy, even if you don't know what it is. Or I can tell you, I get tons of cases where they come with negative cultures, like negative bacterial cultures, and I'll do a cytology and they're just covered in malassezia. Like,
oh no.
I mean, it happens all the time.
Oh.
So just like anyone could pick up yeast. I mean, right? Like, loaded with yeast, got that. So just always do them. It's just like such a chronic issue that we see. I mean, all over. All of my fellow dermatologists who consult are like, I don't know why, they don't do cytologies. Like I said, even if you don't know what it is, you'll at least be able to figure out, okay, it's not this, it's not this. I don't know what that is. Like, I'm going to send it out. The other thing is, if it looks weird, like, never be afraid to scrape something, because, I saw a dog just a couple months ago that, had scabies everywhere and had been treated for allergies for like 8 months. So if it's like really weird and not typical, it's never wrong to get a negative skin scraping. So just do it. Just scraping cytology. If you do those, I'd be really happy. If it comes to me and I need to biopsy it, I'm totally fine with that. But cytology being the big one, if it's weird, don't be afraid to scrape for sure, because you don't want to be the one that ended up putting the Demon X dog on a bunch of steroids.
Right. Or even, I can't imagine how embarrassing that would be for the vet who had the dog on antibiotics and kept getting negative cultures, and then finally sent it to you and it was yeast. Ouch!
Oh yeah, no.
So easy to see. They're like the most obvious thing.
People don't feel confident, and I get it. Like, if you're in general practice, you're seeing cases fast. Like, I totally get it's a different world. I've worked with GPs. I went straight through, so I've never personally been a GP. I have so much respect for GPs because you guys get so much thrown at you, and I don't have a dog coming in that was just hit by a car in the background of me seeing, my skin recheck case. So I get it. Like, it is different. But if you really get good at cytology, you can do it fast, or even collect it and then you have to read it later or whatever, but you can really teach yourself to do it quick and
that's true.
And really get at least some information based off of it. That if you don't know the nitty gritties that we might necessarily know, you can at least get some things checked off your list and then at least not miss like a yeast dog or something.
Right. Yeah. And I like what you said about you can check it later. So if you're really crazy, you can just say, I'm going to take this sample. It's crazy right now. I'm going to send you home. I'm going to read the slide later. So I will call you later. Yeah. That's great
it's not ideal, right? But it's better than not doing it.
Absolutely. Well, I think that's a fantastic. I wish I would have thought of that when I was doing general practice.
So it's always different, right? We never do them later, but that's our bread and butter. Like, we're cytologing everything almost. So, we get really efficient at it, even if we're behind. But again, you just can't, in the grand scheme of things, like it's a fairly inexpensive test. It's just a slide and stain and a microscope you need, which you already have at the clinic. So it really is just something, and it just, besides just bacteria or yeast, so you can see, you got me in my soapbox now. So now you're going to get like the derm lecture part of me. But besides just bacteria and yeast, it can tell you lots of things. So you can see what type of inflammation is present. If you're getting really good at, cytologies, you can see acantholytic cells for a pemphigus animal. I diagnosed dermatophyte. So just, seeing that it's a really weird looking case. All of a sudden I look and I just see lots of fungal spores under the microscope. So it can give you a ton of information. Even if you don't say, oh, I know it's this disease, it can at least kind of tell you what's going on. And I use cytology for all my infectious cases to see when, so one of the biggest questions I get asked is, well, how long do you treat them with antibiotics or antifungals or whatever? And my answer is always, well, it just depends. Like, are they responding? What does their cytology look like on recheck? So there's lots of things that you can gather and use that tool for. And it's really nice that you can do it in-house. And owners are always so impressed when you can say, I will tell you, if you don't do it later, hey, I can go tell you the results in 5 to 10 minutes. And owners always think I'm going to send it out. I'm like, oh no, I'll be back in like 5 minutes and let you know what I see. And they're just so excited about that.
Yeah.
So that's probably like one of my biggest, the derm part of me, that's probably one of my biggest things is just like, do not be afraid to do those.
Right, right. Well, I mean, that's like a classic medicine lesson in general is like, if you don't look, you're not going to find it. It's a matter of looking.
Yep. Yeah, it is. And if you pull something and it's weird, you can send slides in to have someone look at it. Yeah. But it's much better to have to send a slide in if you don't feel comfortable than just throwing them on cephalexin all the time. And then, methicillin resistance is such a big deal for us right now. Yeah. So to put patients on it that don't need to be on it, like at least you're avoiding that aspect of it.
Okay. Well, Dr. Bourgeois, how do people get in touch with you if they'd like to, for instance, learn more about your coaching or just any way for people to get in touch with you?
Yeah. The biggest thing for me, as you and I have met, I really love Instagram just because it's quick and easy and personable. And I put a lot of my wellness stuff up there. Plus actually I'm starting to dabble in a little bit more, putting some of my veterinary life, I put my mom life up there. And so my Instagram handle is just Dr. So Dr. Dot Ashley Bourgeois. So it's all kind of one word after that. And so I'm always checking my messages and reaching out to people that way.
All right. Well, I'll put that in the show notes. And as a sort of a thank you, is there any favorite charity that you have that you'd like to mention that if people found this helpful and want to thank you for your time and advice, they could consider making a donation?
Sure. Ever since I was in vet school and I guess 11 and a half years ago, adopted my first love, which is my terrier mix Darby, who's almost 12 now. I got her when she was about 5 months old. Like, I think I was only a couple months into vet school, so I didn't last long. I lived right by the Humane Society. I go there every day after school and look. So I am a huge advocate for all local humane societies. I'm definitely like an adopt rescue person. So that's kind of where my heart is at, is just, whatever humane society is closest to you. For us here, it's the Oregon Humane Society. But yeah, I love finding them. Whenever anyone asks me what type of dog are you going to get next, she's 12, which is really hard for me. I say, whatever I find.
Right. At the shelter.
Yep, at the shelter. I mean, that's just kind of, I love those mutts. I don't know what it is about them. I love when you don't really know what they are.
And I love how everybody asks when they come into the vet office, like, what do you think he is?
I know.
I don't know.
If they ask me that, or if they try to ask me like how old they are, I'm like, listen, my own dog needs to go in to get a dental. She sees someone else. I don't look at teeth anymore.
Right, exactly. All right. Well, yeah. Dr. Ashley Bourgeois, thank you so much for your time and advice. And please thank your husband as well for giving us this time to talk.
My pleasure. Thank you so much for having me.